Good morning, everybody. Do we need another minute to get coffee? We're good? Great. Well, thank you so much to the American Sleep Apnea Association and also to Justine and Adam. I think this opportunity to come together as patients and talk about the very diverse ways that sleep apnea can present and how it can impact lives and all the things we can do about it is critically important, and I really applaud these efforts. And thank you so much for giving me the chance to participate in these efforts today. Like Adam mentioned, my name is Shanon Sullivan. I'm a sleep specialist, pediatric pulmonologist by training. In fact, I trained at UCSF just down the road and spent a dozen years at Stanford under the aegis of Dr. Christian Guilleminault in sleep medicine there. And at that center, if you come to the round table a little bit later, we can talk more about it. One of the missions of the center is to really understand sleep disorders and sleep apnea as something that can occur over the lifespan. So it's not just a disorder of middle-aged and older adults, but it's something that can impact folks of all ages, as Adam mentioned. And today, I've been asked to discuss with our panel today about how sleep apnea has impacted their lives and how it may have presented, at what age it may have presented, and to hear a little bit about their stories. So I really would love, I'm really grateful for the opportunity to be able to focus on these patient stories. And with that, what I'm hoping that you all can do is introduce yourselves and talk a little bit about how you came to understand that you might have a sleep disorder, what it was like in your life when you realized that that was the case, and to explain a little bit about your history and some of the impacts both having the disorder and then also treatment has had on you.
Oh, okay. Hi, my name is Karen Walk. I am a 48-year-old female, and I came to the world of sleep apnea through my psychiatrist's office in December of 2011, where I presented with memory issues along with what he thought was ADD. That started to come along with symptoms of hypersomnia, and I eventually became so depressed that I contemplated suicide. Sorry. My psychiatrist took me through kind of I guess a journey, personal journey through many doctors, started at the neurologist, went to the rheumatologist, the endocrinologist, and then I ended up getting a sleep study. My daughter was going in for restless leg syndrome, and the sleep doctor got a look at me and realized I had been sleep deprived for a long time, and got a look at I was trained by Dr. CG too, and so she got a look at my structure and realized that I also might need to go get a sleep study. So that's kind of where it started, but that in between, that was in 2015. So during that whole time, I had developed a mild cognitive impairment, which was impacting my entire life. I was told that there was a strong possibility that in 5 years I would be diagnosed with some form of dementia. And it was difficult to work. I was on disability for a year. I spent most of that time in bed. And I did, go through treatment with CPAP and then BiPAP, and Dr. CG holding my hand through the whole thing. And eventually I did opt for another alternative. I did get the Inspire implant, which that actually made a difference for me. I know that it's only certain patients that qualify for the device, and not every, in the gold standard is CPAP. And I gave it my all. I did all of the cognitive behavior therapy and everything that they could throw at me. And a year after my implant, I am feeling much better. I work full time, sometimes even more. I get to do a lot of volunteering. I get to meet patients that are suffering the way I was, mostly women. It was what kind of inspires me to help. I see people that when I mention my story, they can relate, they remember feeling, and they are feeling the way I did before, and they're not getting help, and they're not getting diagnosed, and they're stuck at the psychiatrist's office, and they haven't gone any further. So that's why I'm here today.
Thank you so much, Karen, for sharing that. so much insight in the story that Karen just shared with us. On the one hand, your journey to go through multiple specialists complaining of symptoms that were related to a sleep disorder, but was difficult for folks to put their finger kind of right on the pulse of what was going on for you.
Yes.
And the kind of happy fortune of finally being in front of someone who noticed that you might have a problem, but not because of you, but it was your daughter's medical visit. Yeah. You know, that's something we commonly hear. I would love to say that's rare, but sometimes the symptoms of sleep apnea and other sleep disorders as well are not straightforward. It's like they didn't read the rule book on how sleep apnea was supposed to present. So if you are not a man with a girth of a certain degree and a neck size of a certain degree, and you're not in a certain age range, it's possible that your clinician may not immediately leap to thinking about or asking about sleep disorders. Like Anna mentioned earlier, you end up having to be an advocate for yourself and sort of navigate a journey that is anything but linear in order to finally get to find out what's needed, what's going on, and then what's needed. And on the treatment side too. Yeah. Could you describe a little bit about how it felt to have to try different therapies? And sort of what that journey was like, because it's often the case that the first thing you try doesn't work the first time you use it. What was that like for you?
So my first experience in that sleep clinic when I went to get my kind of eval was I saw a patient that was leaving the office, and I heard a comment of, well, they were non-compliant, and they were talking to each other in the office, and I was like, I wonder what that means. Like, that's kind of a weird thing, because he looked pretty upset when he left. Apparently, he had been on his machine for a while and just enough time to see if the insurance would improve it, and he wasn't using it for enough hours. So that's what I found out what non-compliant meant at that time. Now I realize it's kind of a bad word. I don't. I feel like what was most frustrating was because I had quite a few comorbid conditions. They were kind of getting in the way of my success, and also because I had developed quite a bit of insomnia. I was doing the cognitive behavior therapy for insomnia and then from nightmares from the mask. So that I had started, they said, well, you're having trouble actually breathing, so we'll move you to BiPAP. And I would say that it was like, for me, just trying to do the therapy even though I wasn't feeling any better. Just so I made it kind of about the score on the machine. I tried to find something to attach to, but then I found that there's like a huge social network of people that are also suffering. So that would be the thing that gave me some hope, was there were other people that had the same fears and worries that I did. And then the other thing I learned to do was Zentangle, because I was trapped in bed. So it was one thing I could do without getting in my car and going somewhere, and also social media, I could share my art. But going from the CPAP for a year and then BiPAP for a year, I would say I wanted to prove I could do it. I wanted to be better, and I was willing to do anything that anybody told me to do. So I think that I found, though, that I think that's unusual. But there's a tremendous amount of anxiety that would go on about having the mask on. I feel like that it needs to be destigmatized, because people that don't have sleep apnea don't understand unless they have a partner or a friend with it. And I think it would scare the bejesus out of me before. So I would really, that's something that I worry about. Patients are afraid. My father, which I don't want to call him out, but he doesn't want to have a test. And it's really hard for me to accept. And I think it's for the same reasons. He's afraid of the treatment, and he doesn't understand it. So I think like the lack of understanding about the benefits of successful treatment.
And I thank you so much for sharing that. So my first question is, did you ever feel a year on CPAP, a year on bilevel before you found something that was the right balance for you to treat your sleep apnea? Did you ever feel like just giving up?
So that was around the time when I was giving up. I would say it took me a year to get approved for my implant. And during that time, I would say right before the approval, I was going through some independent medical reviews and they weren't going my way, and then I had them do another one. And I remember I spoke to, I spoke to the person at Inspire on the phone, and I told them I'm kind of done. And they said, just keep holding on. And I think if she hadn't been there for me on the phone, that was going to be it. Yeah. But I would say that I was suffering from chronic depression, according to my psychiatrist, which I still see him. He's still my case manager. He now tests all his patients, has them go to get sleep studies. He now recognizes, he asks them, how are you sleeping, where he never used to ask before. And he's really happy to see that I'm feeling better. But yeah, we do talk about a lot. He has, tons and tons of notes of me just being almost refusing to feel. And because I couldn't find my words, I was lost most of the time when I was anywhere, even in the hallways of the doctor's office. I couldn't find my way around Stanford. I would get lost driving. I would get lost everywhere, and I couldn't remember the simplest of words. So as I was watching things kind of disappear, the fact that I knew I was losing my memory was the most devastating, I think. I almost think that when people are losing their memory at a pretty rapid rate and they don't know, it's almost a blessing. But not knowing not getting any resolution was frustrating. But I think that knowing that there was a little bit of hope kept me from doing myself in, really.
Thank you. That's a very powerful story. I have a question for the audience. How many of you have heard the word non-compliant with respect to sleep apnea treatment? Non-compliant. Does anybody want to hazard a guess what that refers to exactly? I dislike the word. How can you say that? But anyone want to share what it means? We have a microphone up here. Someone wants to take it.
We have a microphone in the room as well. I can give you what I think it is, Shannon, and that's, I always like the word adherence from a patient perspective. Yeah. And it's a rule that's been set up by CMS and the insurance companies to make sure that patients are using their machine 4 hours, at a minimum of 4 hours or 70% of the time for the first 90 days. Is that correct?
Yeah, a consecutive 30-day period. It's even worse.
It's even worse.
So you're right. I think adherent is a more proper word. And even that, I think, because of the experience that Karen so beautifully laid out, even adherence, I think, is overly reductionistic when you're really talking about the type of journey that folks with sleep apnea are taking. But non-compliance is a payer terminology, and it exactly refers to what Adam said. In the first 90 days of PAP therapy, you can find anytime in that 90 days a 30-day consecutive period within which the individual is using their device, the blower is on, essentially, for an average of 4 hours, at least 4 hours a night for 70% of that 30-day period.
And what's amazing about that rule is it's so antiquated and right. Archaic, is that you need to wear that machine, more importantly, in the last 4 hours of your night, when you're going to have more sleep apnea, more sleep disturbance breathing. So this is the only intervention, the only drug that when you don't use it enough, they come and take the machine out of your house. So if you're a diabetes patient and you're not using your diabetes medicine, they bring the education to you. They want to know why you're not treating your diabetes. Same for hypertension. So you can imagine, this is a harder intervention and a harder drug to get than OxyContin at this point because of the rules that have been put in place.
So I want to make sure we give time to everybody and hear everybody's experience. But I had a little bit more reflection for you. One was, I was so happy to hear what you said about your clinician, that your clinician turned around and understood the impact that sleep apnea had in your life and was made more aware for other patients. And what I wanted to say was, good clinicians learn from their patients. And so you sharing your experience and being able to put together pieces for a clinician is critical. And that's something that all patients can do, is make sure that they loop back around to their clinicians. You went to a rheumatologist first. You might have been to other specialists. who might not have been aware that what you were experiencing was a result of a sleep disorder. And the way clinicians get better once they leave their formal medical training is to learn from their own experience in patient care. So thank you for doing that, because you've impacted the lives of more people by being able to move back around that way. So thank you. So I wanted to talk next to Brian. You're next in line on the table. Could you tell us a little bit about your experience with sleep apnea?
My name is Brian Delaney. I'm 47. I was diagnosed with sleep apnea in 2003. I'm a retired law enforcement officer, and for me, I reached rock bottom for about a 6-month period where my sleep apnea was so bad that I was falling asleep at work and falling asleep driving, falling asleep on an elevator, falling asleep anytime I sat down. And, work looks at you like if I got caught sleeping, I would have been fired from my job. And the straw that broke the camel's back was I was driving home one day, and I had experienced where my brain turned off and my eyes were on. I could see, but I wasn't thinking straight. And I got off the wrong exit on the interstate, and I crashed into 5 cars and caused a horrific wreck. But nobody was injured, but that was what made me realize there was definitely something wrong with me. It wasn't just insomnia. It was just, something beyond what, a normal person would, my knowledge, experience. So through my research, I just happened to think, well, maybe I have sleep apnea. And I went to a doctor. And for me, I was successful with CPAP. The first 4 hours they put me on that thing, it was like my brain restarted. And I changed. I went from being incompetent, I guess would be the best word I could think of, to restarting my brain and restarting my life again. And I've been using this machine every day since 2003. I discovered through my own education and research that there's a lot of people that don't know about sleep apnea. So what I did was I ended up starting a Facebook group called Fun with Sleep Apnea, and I use humor to educate and aware people, to break the stigma, because during my career I've had deputies beneath me that I've noticed from their behaviors that they might have had sleep apnea. I remember I stepped off an elevator one day and one of my deputies was sitting there sleeping, and I was like, what's going on? Every time I see you, you're sleeping. And I made him go to a sleep doctor, and he ended up having sleep apnea. And then it was like 2 or 3 other people. So I take it upon myself to try to educate as much as possible, because it's changed my life. My father died, in my opinion, of untreated sleep apnea. We used to think it was funny to see him fall asleep, snore, and then stop breathing while he was sitting in his chair. And it was always just that's Dad. But he died of a heart attack at 59. So based on what I know now, if he went to a doctor, I guarantee he would have had severe sleep apnea. Because my sleep apnea was so bad, it was 145 AHI. And on a machine, it's now like 0.3. So, I know it works because, I admit, I've napped without it. And I know when I wake up after a 20-minute nap that I was probably risking my life sleeping without that machine. It's changed me for the better.
Thank you so much for sharing that. I have a couple of reflections. I also invite our audience here to share their reflections. One thing is this, because this is something as a sleep medicine clinician, we hear a lot. Within families, the symptoms of sleep apnea are normalized. That's just Dad. Everyone in my family snores. We're just like that. And you yourself mentioned you after your accident, you thought, wow, it's not really just insomnia. I could have something else going on. So you were aware that something wasn't quite right about your sleep. Do you remember, had you had a conversation with your clinician, or had you thought about?
I tried everything I could think of to try to sleep, every position, everything. The first 2 years of my marriage, I slept on the couch so much. But I never knew that there was sleep apnea involved with that snoring. It took, like I said, for me to hit rock bottom to know there was something beyond that. But it was just more, I guess, luck. I was just researching things, and then I fit the puzzle piece perfectly. Like with her, she didn't fit it perfectly. She had to find her path. But for me, it fit perfectly, and and the CPAP worked perfectly. So it was just luck, I guess, for me.
And the other amazing thing, well, a couple of amazing things about your story. One is the amount of research you did on your own behalf. And this is really interesting because I was recently reading the research results from last year's, the 2018 survey. And I believe, Adam, correct me if I'm wrong, 38 or 39% of individuals decide on their own or go on their own power to seek out sleep apnea diagnosis. The majority of people are being told by someone else, a physician maybe, or a friend, or a family member, a bed partner, I think you have a problem. And the individual themselves is like, I don't know about that, but ends up going to get an evaluation. And I think it's remarkable that you were able to do the research yourself and put the puzzle pieces together and take the initiative to promote your own diagnosis and treatment thereafter. What do you think about, like you mentioned that in law enforcement, you saw other people in your environment that you thought might be suffering from possible sleep apnea. What do you think about sort of the stigma of having sleep apnea, or this kind of like a tough guy or tough individual sort of approach where I couldn't possibly be me, I'm not like that, I'm fit, I go to the gym 3 times a week. That's not the sort of problem that I have. Could you comment a little bit about that and whether or not you feel that's a barrier?
Well, for me, I blamed it on night shift. I'm working 6 p.m. to 6 a.m. That's why I'm tired. Mm-hmm. But it was beyond that. And yeah, there's a stigma. You have to wear a mask. It's embarrassing, and that's why I run that page, because I try to break past the stigma and make it like it's just a mask with Velcro. You know what I mean? It's not that big of a deal. Put it on. If it's cold, it's great. You can wrap a blanket around your head and cocoon in the winter. I live in northern Michigan, so it's phenomenal to be nice and warm, but you still can breathe because your mask is on.
I'm always happy to meet someone from Michigan. I'm also from Michigan. It does get cold there in the winter, I'll tell you. And how about, and can you tell me a little bit about what it was like having to accept CPAP? You can speak in general terms if you want, because it's a bit of a personal question, but what it's like to accept a therapy for a medical disorder that ends up coming into the bedroom with you and in bed with you. So it's kind of different to sleep. I don't know if you've slept with a machine before, with a mask and 5 feet of tubing connected to a machine at the bedside table. That's a pretty dramatic change for most people who've spent their entire life sleeping without a device like that in the bedroom. Can you talk a little bit about what that was like? Because you mentioned you had slept on the sofa for a couple of years.
Yeah, my wife, she thinks the machine's great, because for the first, 3 or 4 years, I don't even know. I slept on the couch. I never slept in the bedroom, because I felt bad, because every time I started to snore, she'd leave. And then I'm like, no, I'll leave. I'll go on the couch. But ever since, obviously, with the mask, I don't snore. So it's been positive. I've only had positive feedback from wearing a mask.
And talk a little bit about other types of positive feedback. In terms of, have other folks in your family noticed you seem more awake after Thanksgiving dinner, or you're a little bit less grumpy? Have you gotten any kind of like subjective feedback about sort of behavioral change or affect change?
Prior to CPAP, that I would say about a 6-month period was really bad. I mean, I might as well have been a drug addict, because I was incompetent. My brain wasn't working correctly. I slept at red lights. Like, oh, it's red, I could sleep for a couple seconds. So it made a massive change. I mean, I felt I could think clearer. I could do my job better. I stopped falling asleep in corners and finding places to nap.
I think, and I want to come back to this issue of the car accident, and then, like you just brought up, the near misses. So it would be awesome if we had a perfect crystal ball and could know ahead of time when we might drift off behind the wheel. And sometimes near misses are there to kind of be a red flag, but they can be difficult. And someone who's the night shift worker, for example, you're also looking at a circadian rhythm challenge. There's probably multiple reasons you were sleepy. And it's easy to find excuses in a way so that you might not initially understand a sleep disorder like sleep apnea. But near misses are big red flags. Our mantra is drowsiness is a red alert behind the wheel. But in fact, many car accidents, vehicle crashes every year are due to drowsy driving, and sadly, many fatalities are every year due to fall asleep or drowsy driving accidents. So it's a real public health threat. And the thing is, it's an opportunity for change because this is a treatable disorder. And as we're hearing from our panelists, they are not all on the same therapy. They have all had a different journey, and they have all have found a different way to be able to address the symptoms related to sleep apnea. But I think calling out the critical threat of sleep apnea for drowsy driving and accidents is a really important one, because we all want the time to be able to get diagnosed and the time to be able to get you treated. But in the case of a serious accident, that can very quickly sort of end the story in a very tragic way. So I thank you so much for sharing that. I have a question for Adam. I see you in the back. Do you want to do some live response questions at this point, or do you want to keep hearing from our patient panel?
Let's go through and hear from all our patients, and then we can ask a question at the end.
At the end? Yeah. You got it. Okay, looks like we're on to you, Janice.
Hi. I have a genetic disorder called Noonan syndrome, and the Noonan syndrome causes my facial dysmorphisms that include the very small chin, receded chin, and very high arch palate. So it was kind of inevitable that I would have sleep apnea. My mother had the same thing and snored terribly. I remember coming to San Francisco, she had to have a medical procedure, and we were staying in a motel here, and I couldn't sleep that night because of how loud she snored. My daughter has the same issues. Luckily doesn't snore. We had good orthodontia for her, and she's not going to have the same problem, luckily. I had what they call retraction orthodontia that pushed my teeth back and ended up with a more narrow problem than I would have before. But I was in deep, deep denial. I mean, I knew what sleep apnea was, and when my snoring got really bad, my husband spent about 2 years sleeping on the couch for me. He made fun by getting himself footy pajamas to stay warm on the couch, and a doctor asked me about it a couple times, and I said, oh no, it's allergies, you know, my nose is stuffy. And finally, somebody talked me into getting a sleep study. Before the results were in, I went for a pulmonary function test because I also have pretty bad asthma. And at the pulmonary function test, the tech could see my sleep apnea scores from the test, and she would not let me leave without a CPAP machine. She said, you are not leaving this building without it. And I really ran kicking and screaming from doing that. It was the last thing I wanted to do. When I went for the sleep test, it was a home study through my HMO. I went with the idea that I was going to refuse the test because I thought it was going to be a sleep lab where you have to go in and be wired up and spend all night being watched, and I absolutely would not ever have done that. But it turned out to be the WatchPat test where they put a little probe on your fingers and something on your wrist, and I said, oh, okay, I'll do it. And I think that saved my life. I think I was in really bad shape at that point. I was very, very lucky to have her insist that I take home the CPAP that night because this HMO does everything in groups. So you go and they say, you're invited to take home a test for titration. You get to take the machine home, and people can refuse at that point, and she would not allow that for me. So I was very lucky. And because of comorbidities like sensory issues, it was very, very difficult to get used to sleeping with the CPAP. When they send you home for titration, there's no humidifier. It's a full face mask. It was horrible. I kept going in and getting different masks to try and things, and it took me about 3 months to actually sleep through the night with the CPAP machine. I had panic attacks too because of claustrophobia, and I remember waking up and going, okay, I'm going to count to 10 before I rip off the mask. And sometimes I would make it through counting 10 and I didn't have to rip off the mask, and other times I would rip it off. and then put it back on and try to go to sleep again. But one morning, about 3 months in, I woke up and realized I had slept through the night. And I remembered what it felt like when I was a little toddler, waking up very peaceful and calm and comfortable. And that's how I felt that morning. And it was the first time in decades in my life I had woken up that way. And that made it worth it to keep on going. I had more bad nights than good nights until I had more good nights than bad nights. It just took a lot of effort to get there, tweaking, doing whatever I could to make it work. And when I was finally successful, I had so much more energy. I felt so much better. Other things in my health improved because I had enough sleep at night. And my HI was very bad. My oxygen levels were very low when I was tested. So I'm really grateful that I have CPAP now, but I sure went to it kicking and screaming, I would say.
Thank you so much for sharing your story. You know what I loved is your expression about how first there were more bad nights than good nights, and you just kept working at it until there were more good nights than bad nights. So I have the same question for you. What gave you the energy and the dedication, the kind of stick-to-itiveness to be able to work through how obnoxious, if you don't mind the word, how obnoxious this gear can be the first night you have to go home and put it on? What helped propel you to eventual success?
Well, I think the very first thing is that I no longer, my husband was able to sleep in the bed with me. And that was big because I felt really bad. And I think I did it for him more than anything else at first.
Awesome. So right now I want a round of applause for two different individuals because we've heard in a couple of stories how important family members and in particular bed partners or spouses are for people who have sleep apnea. So a round of applause. Because the story isn't just it's their story too. There are people with footed jams out there sleeping on the sofa because sleep apnea is in part of the family. It's in the life, and it's important to remember. And the other, I want to also share that round of applause or show some appreciation for all of the folks, the respiratory therapists, the sleep technologists who are on the front line when they see someone who has a type of sleep apnea that you had and sort of say, don't move. You're not leaving here until you get a device, which is hard to do. In the modern era, this is not the way the process works. And Adam has written about that the kind of like disbelief that you could be diagnosed with a severe disorder and yet just be told, just leave the clinic, we'll see you in a couple of weeks, hopefully we'll get something going for you by then. It's a real disconnect to have, to be told you have a severe disorder and yet a little pat on the hand will take care of it eventually. It can be a little bit disillusioning. So I think it's fantastic that you found yourself in a situation where someone took a stand for you and said, that's it. And it's a call to everybody here and everybody who's watching or listening to say you could be that person because probably in your life you know someone who has sleep apnea and you know someone who has a sleep disorder. And there are lots of excuses. It's allergies, it's my shift, it's my job stress. And you can be the person who says, you know what? Life can be better. Take a stand. I'll help you get across the finish line with this. So these stories are very inspiring to me because on the one hand, they provide insight about how different the journey can be, but also how important it is to have that one person at that critical moment who said, you can do it. Karen shared the same thing. She was on the phone saying, I'm ready to give up. And the person on the other end of the line said, hang on, you can do this. So simple words can make all of the difference in a journey like this one. It's not straightforward. It takes a lot of effort. You hit obstacles and it can feel very alone at that moment, which is why things like online chats or having a group of individuals who can cheer you on can be so very important. So I really appreciate those pieces of your story.
I just have to say how important the online community was too, because There were many nights I said, I can't do this anymore. And there were people that gave me kicks in the pants, like, there's no choice. You do this and, you know, we'll do anything to help make you more comfortable, but don't give up. And that was really important.
That's right. And, you know, to a certain extent, the clinician that you see who's going to check in with you on your apnea and how things are going might do that a little bit, but it's the middle of the night chat. It's the person who says, I've been exactly where you are. I know how you feel. Push through it. Yeah. Give it another go. See what you can do that can make all of the difference. So again, as a patient-focused, patient-run organization, there is such a role to play. It is, as has been said, it's a team sport. And this disorder cannot really be treated unless the community of patients who have sleep apnea pull together and push forward and help individuals with sleep apnea push forward. So it's an incredible story. I have another question. This is actually for all of the panelists, but I'm curious to know, because so a couple other things were mentioned by Janice. One was a high arch palate. Does anyone know what a high arch palate is? Okay, so I think you guys are going to get a little bit of this afternoon with the clinical talk, but it refers to sort of the arch of the roof of the mouth, and it's if it's narrow, or high and arched, it can be associated with a higher likelihood of having sleep apnea. That's something that can be observed in childhood. And you mentioned your daughter had this observed in childhood, and probably your mother had the same thing. And so I heard something different, which is, wow, you know, this disorder got missed for probably a long time. Probably this was going on for years before you finally found your way into the medical system. So this is a question for all of you. And Matt, we haven't gotten to you yet, but I'm going to ask you too. When do you think your symptoms from sleep apnea first started? Looking back in the retrospectoscope, so to speak, looking back over your life, how long do you feel like you may have had sleep apnea before you finally found your answer?
Yeah. Well, I mentioned remembering what it was like in bed as a toddler when I woke up, and I think right after that, because I don't remember sleeping well the rest of my life.
So from toddlerhood.
Yeah.
Yeah. And did anybody, or did you kind of come up with alternative explanations for why it was that you weren't sleeping well?
Well, I have a heart problem, and so, you know, maybe it was issues with that, but, and with Noonan syndrome, kids especially have a lot of leg pain. So there were all sorts of other things interrupting sleep. But what I recognized when I finally got treatment is that I'm probably sleeping bathed in stress hormones all night, and I would wake up like this. And now I wake up just so calm and comfortable that I don't even want to take my mask off for a while, because it just feels so good.
It's a win.
Yeah.
How about you? How about you guys?
Well, I definitely know I had as a child, Dr. CG asked me some great questions, like, did you wet the bed? And I'm like, yes. And he's like, well, that's a sign. And I was like, I don't even understand that, but it makes sense now. But definitely, I don't remember ever not waking up gasping for air, but I never, ever had anybody ask me about it. And I always had panic attacks later on in life. That was one of my first symptoms. No idea that that was from the fight or flight that was going on at night.
How about you, Brian?
For me, I think my college roommates would tell you that my snoring was horrific.
Legion.
And I really didn't notice any lack of sleep until, you know, when I was more like 30 years old. But, I mean, I've had other people complain about me snoring, but I didn't notice any real sleep issue until about 32 years old. But, I mean, it could have happened. I just didn't pick up on it.
Restless sleep, sweatiness in sleep, parasomnias, sleepwalking, night terrors that don't follow the playbook. You know, sleepwalking and night terrors are not uncommon in childhood, but they have a certain pattern to them. And when something smells a little different about them, they don't disappear when they're supposed to disappear or abate. They're more common than usual. They're not appearing with the most common triggers. These are often related to undiagnosed sleep apnea, not always, but things that we think about. Not being able to wake up for school in the morning. So we take a look at adolescence. Right now, there's a bill going to be sitting on the governor's desk in the state of California to address high school and middle school start times. But we probably, as a society, look at young people not waking up for school as being an adolescent thing, or they were up too late on their electronics. But what about the possibility that their sleep wasn't refreshing? And maybe their sleep wasn't refreshing because they have a physical disorder that's impacting the quality of their sleep. So these are all things that, again, they don't get diagnosed right away as sleep apnea, and we can look back once you have the diagnosis and put together the pieces, but it would be so awesome if we didn't have to wait an extra 10 or 15 years to get that diagnosis, or 20 or 25 years to get that diagnosis. It would be so awesome if we could identify up front a priori that this is going on and act when there's more gains to be made during growth, like what you explained with your daughter. Thank you. Last but not least, would you like to come over here and speak? Are you okay over there, Matt?
Actually, can you hear me? Okay, great. No, I'm fine right here.
Okay, perfect.
Thank you. Good morning, everyone. Hello. Where did Teresa go? Teresa, Justine, Adam. This is amazing. This is great. Thank you so much. And everybody else, there's a lot that goes into this. And thank you for inviting me. This is awesome. There's a reason I'm standing, and that's because I have something called a sitting disability. It's very invisible, but I'm in a lot of pain. I suffer from chronic pain. Oh, there's Teresa. Hello, Teresa. I have 2 titanium rods and 6 bolts in me. I got fused, and so it's really hard to sit, so that's why I'm standing. That ties in to my story. It's pretty amazing. In 2001, right before 9/11, right before the birth of my son, I fell down a flight of stairs, bounced a couple times, landed on my shoulder. I thought I was paralyzed. It was the worst day of my life, easily. It was horrible, and it's never been the same. At the time, I was 350 pounds. I was very large the majority of my whole life. That's all I know. Mentally, I'm still heavy. But compression fractures, I had 5 fractures, and they heal over time, and I eventually got working again and just continued living life, you know? But I didn't know that the weight was weighing down on my spine so much. So fast forward to 2011, I herniated a disc, and I had to have 2 surgeries back to back, and a lot of co-pays and pain and time later and MRIs. I went from 1 herniated disc to 2. My surgeon, he said, first of all, I've never seen a 40-year-old with a spine that looks like yours. It's really, really bad. He said, you have to have a fusion, but you have to lose weight. And I was like, well, how do you lose weight? I don't know how to do that. So I was actually forced into having weight loss surgery. I had the vertical sleeve, gastric sleeve, and I lost 140 pounds in the first year. It was amazing. I still can't believe it. And so between those surgeries, my back surgeries, I finally got my first sleep study. And I, of course, had really bad sleep apnea. But I didn't want to wear it. I hated it. I kind of knew it would help me, but I just was going through a lot, and it was just, I lost weight, and I got a letter that said, hey, you're not being compliant, and you either return it or buy it. And I was like, well, you know what? I lost 140 pounds. I'm skinny now, and I do not need this machine. Here you go. I never followed up with my sleep study. And that was a huge mistake. I just assumed that, it was weight. I'm fine, so. Yeah, it's definitely not weight. It could be skinny people. Mine's definitely now that I know. I mean, I've been asleep my whole life. I've never had this kind of energy, ever. I've been asleep my entire life. Now I know my father. I'm looking at my father, my son. It's without a doubt hereditary. that's their story to tell. I could go into their stuff, but like they won't get sleep studies, you know? And all I do is preach it. The mask is the best thing ever. So I had the surgeries and fused, and I'm permanently disabled. I mean, it's been over 8 years now, and it's nonstop pain. I wake up in pain, I go to bed in pain. Got to smile and act like everything's fine, but it's not. It sucks. But it's the silver lining is I could have died of a heart attack already, you know, or got diabetes. And I haven't had soda in over 6.5 years. I've kept it off, very determined and focused. And I had a total of 8 surgeries in 6 years. Returned my machine, and I just assumed that I was messed up in my brain because I just had been through a lot. My failed marriage and surgeries and lost my job, and just my life was horrible. So of course I'm gonna feel horrible. And I have to take, come to find out, I finally got a sleep study. Years later, I finally followed up, thank God. I've been wearing my mask for like 2 years now. I've reverse healed from a form of brain damage. I was really, really, really sick. Not only do I have obstructive sleep apnea, but I have something called central sleep apnea. I take pain pills. I have to. I'm not addicted to them. I take them. I don't take too many, but now reflecting back and looking at it, I can understand why some people were concerned about me. You know, I wasn't acting normal at all. I was all spun out. And I couldn't understand why, because my doctor knew. I had validation on my whole doctor team, you know. They knew I was tested and everything. My family and friends, they just, Matt's Matt, you know. And so central sleep apnea, for anybody that doesn't know, for what I know, what I've learned, is the communication between the brain and the heart completely bypasses the throat and everything. And it's very, very dangerous stuff. And the opioid pill itself can cause central sleep apnea. And so I'm still on the same exact dosage as I was in 2011. The only thing that's changed in my life is the fact that I'm getting oxygen to my brain. And once I started changing and feeling better, then people were worried about me. They're like, hey, why are you acting different? Some friends and family thought I started taking drugs, like I was on some speed or something, man, because all of a sudden, Matt's different. And it was the mask, it's CPAP life, I love it. I still don't know who I am sometimes, but the reverse healing process, that was really difficult, all on its own. But the pharmacist one day, who's been giving me the pills all these years, she saw me at Starbucks. She said, I've got my bullet journal, and I'm trying to do this whole sleep apnea awareness. And she said, Matt, I am so proud of you. You've come so far, you're completely different. I'm the one that taught her about central sleep apnea. And that blew my mind. I'm teaching a pharmacist something that, here this whole time, you're giving me these meds and you don't even know anything about it. And I know it's all new and everything, but I always stayed true to myself. I knew I wasn't taking too many meds. I'm in pain. And so now I'm hearing more than 60 people a day are dying and overdosing. A lot of it I really feel is connected to, you know, when I hear people dying in their sleep. I don't think it's always bad drugs. I think people are just really, really sick. They need sleep studies. As far as I'm concerned, everybody should have a sleep study. Clear across the board. So I've come a long way. I've reverse healed. I'm in a lot of pain, but yeah, no, I'm completely different. And my name's Matt, by the way, and some know me as Sleep Apnea Man. I posted a picture of myself, real quick. I posted a picture of myself on Facebook, and it was very embarrassing wearing that mask, but I knew that it was helping me. And I wanted to bring awareness. And then I was like, you know what, there's got to be a day of awareness for this. There's something for everything. And it was on my birthday. And I was like, wow, that's heavy. And then it said that it became officially recognized as the Day of Awareness in the year 2013. And that's the same year that I had weight loss surgery in March. And then in December, Friday the 13th, I had my spine fused. And you're gonna make my birthday the Day of Awareness, which I know now has been changed. But, and so 2 years ago, I mean, this is amazing for me to talk to you about this right now. I'm looking at the bridge, and my first day, 2 years ago, I walked over that. I was afraid of heights my whole life. I don't want to drive over that, let alone walk over it. So on my birthday 2 years ago, put my purple cape on and my mask and a sign, and I walked the entire bridge, and that was like one of the biggest accomplishments I've ever done. And then I flew in an my buddy just got his pilot's license. I flew in an airplane, and then I went to the Space Needle, and everywhere I go, like, people will be, oh, I love your hair. Have you had a sleep study? Like, I am so obsessed with this everywhere I go. And so people like will hide and run from me if they know. But so anyways, yeah, it's very, very, very important. And so if you've had a sleep study also, and you think you're fine, if you get hurt on the job, there's a stigma with the mask and there's a stigma with the opioids. People don't want to say, oh, I'm on pills, and it's something we don't talk about. And I have no problem putting myself on blast because I know me, I know who I am, what I've been through, and the only thing that's changed is that mask. And I know there's other things that can help, but I don't even want to get rid of my mask ever again. It's amazing. So long story short, I'm sleep apnea man, and I preach. I definitely drank the Kool-Aid like Adam and Justine had told me. And yeah, that's my story.
Thank you, Matt.
And I want to point out again how cool it is that you were able to educate someone in pharmacy. I mean, this is the power that you have. You don't know. So for those of you who may not know, central sleep apnea, much less common than obstructive sleep apnea. Obstructive sleep apnea is due to a narrowing or partial closure, increased airflow resistance in the upper airway. Mechanical, also related to tissue. Central sleep apnea is related to the pacemaker for breathing in the brain. And how it impacts the rhythm of your breathing and the timing and pacing of your breathing. So they're different disorders, but in either condition, they can cause you to stop breathing in sleep, and that causes a lot of sleep disruption. They have different associations, so certain other medical conditions can cause central sleep apnea. Certain medications that you may take for other conditions can treat or can cause central sleep apnea. Amazingly, like I think the device you're on, you didn't mention, can treat both obstructive and central sleep apnea. And having one is not protective for having the other one. So it's really important. Again, maybe you get a diagnosis of obstructive sleep apnea, you're wearing your machine and there are a lot of events still on the machine, or you're not crossing the finish line in terms of treatment. It's really important to follow up and figure out, okay, the puzzle pieces aren't coming together, what do we need to do? I know we're going to do the poll, and I want to keep us on time. This is, in summary, first of all, thank you so much to all of you for sharing your stories. They are so inspiring, and each one is so unique. And one of the take-homes I have is, chronic pain, asthma, allergies, kind of classical excessive daytime sleepiness and car accident, enuresis as a child, cognitive dysfunction, all of these different symptoms, all of these different associated disorders, all of them holding hands with sleep apnea, okay? That makes it pretty tricky to be able to, identify that sleep apnea is going on for individuals, for clinicians. So getting the word out there, being an advocate, doing the research, helping other people the way you all have, is just amazing. And I want to give a round of applause to you guys. And then I think we have a poll question for the 2019 poll that's ongoing for the American Sleep Apnea Association that's exactly trying to focus on some of these, what we call comorbid conditions, or these other medical conditions that might be interacting or holding hands with sleep apnea. So is it time to do the questions? Okay. Do you want to read them, or should I do it?
Sure. So the question is your treatment of other health conditions coordinated with your treatment of sleep apnea by your healthcare provider or providers? Is that care of those two conditions, your sleep apnea or your other health condition, be it high blood pressure, cardiac, what have you, coordinated by your healthcare provider? And right now, the big answer is no, it is not. We're up to 70% a no, only 20 people saying yes, 10 unsure. So the coordination of these conditions is not, handled together by one individual, or discussed, I guess, amongst them. So I'll let you.
Is anybody surprised? Okay. So I think this is something we encounter clinically very often, and part of that is a testament on how healthcare is run. So there are bigger issues at stake, but I think, again, this is where patient advocacy and a patient-run group is really important to bring it back in the clinic where it belongs, and make sure that your providers are aware you have a sleep apnea diagnosis, that you're concerned about sleep apnea, and pull together how your other conditions may be influenced by having sleep apnea as well.
Thank you, Dr. Sullivan, and thank you, our amazing, diverse
It's been an
panel of
absolute
patients.
honor. Such a pleasure, you guys. Thank you so much.
Before you guys go down, does anybody have any questions? This is definitely a interactive meeting, or comments or thoughts. Happy. Can you get the mic?
I'm an acute obstructive sleep apnea patient, and I have noticed that there's an awful lot of gadgets, and I don't know which one to pick, because I think that the BiPAP machine and CPAP machine is half of the answer. I still wake up in the mornings tired. I have absolutely no idea if I even got any REM or not. It would be nice to know, what would the Sleep Apnea Organization recommend as far as having some kind of an instrument that could give you an idea of if you actually got full REM or not? And also, I retain way too much CO2, and 2 nights ago I had a grand mal seizure. So that's my question. I think the machine and the mask is half the answer. You need to know the rest of the answer to be able to gauge in what direction you're headed and if you need more care. So that's about it. Thank you.
So thank you so much for that. I'll take a stab at that. I think it's an incredible point that wearing the machine itself is only part of the answer if you're looking at overall sleep health. So the first thing I'm going to say is the machine does not replace total sleep time, like you pointed out. And so if you're living in 2019 and you have a lot of demands on your life and you're only eking by with 5.5, 6 hours of sleep at night, you're probably not going to be feeling refreshed, because it may not be in most cases. In many cases, it's not enough sleep. So total sleep time, whether or not you're making it into REM, how disturbed your sleep is, how fragmented your sleep is, these are all elements of feeling refreshed, about being able to wake up in the morning and say, I had a great night's sleep, and feeling good and refreshed throughout the day. So I 100% agree with your premise. In terms of wearables and devices, there are really many consumer-facing devices that claim or allege to track sleep time, and further claim or allege to track non-REM versus REM sleep. I think these can be refined further. There is nothing consumer-facing that measures, for example, exhaled gas. So you mentioned retaining CO2, carbon dioxide. There's nothing consumer-facing that does that. So that's something that can be measured if you're setting. But that may change as well. There's so much development, and honestly, we're living in a part of the country that's a hotbed for development in wearables, and I think I think it's an incredible area. It's developing really rapidly, and, stay tuned.
We have time for one more question, if someone has a question or a comment. Okay, right here. Hold on one moment.
I have a comment. I'm one of those ultra responsible people who brings my test results, current medication to each one of my medical providers.
Awesome.
It doesn't do any good. There is no one that assumes responsibility. I mean, they'll look at it, and most of the time they go, blah, 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 blah. I mean, truly. So my question is, why isn't there better education for medical students?
Fantastic. You're preaching to the choir here. So on average, medical students are getting 4 hours of any kind of education, any time in their 4 years of medical school on anything related to sleep. And that includes, so-called normal sleep. What do human beings need for sleep, and how is sleep organized? So that's not even getting into sleep disorders. When it comes to, I happen to be interested in postgraduate medical education and sleep. And I can tell you it's even more abysmal when you get out to residencies, because every residency, every specialty manages its own requirements. And sleep is, generally speaking, especially even in primary care fields where you would expect, like nutrition and normal human growth, that these things should be focal points, is considered kind of an elective experience. So there's no requirement. With the exception of ear, nose, and throat, actually. Otolaryngology has a requirement to teach sleep, but in the other fields, it's elective only. So you end up, like with many things, some clinicians who have a personal interest, who are driven by the importance of sleep, and they integrate this into their practice. Again, not to kind of sound like an old saw, but this is why it's so important for patients to say, this is important, to come back to their clinicians. And I know you think it's doing no good, but I bet it is. It's just that there are a lot of competing demands for clinicians, and they have a very limited time to balance a lot of different things. But continuing to promote how important sleep is in your health journey will help clinicians understand that it's important and it's something that needs to be integrated.
I might also add, I have a daughter who's in medical school right now in her 3rd year, and they don't get much sleep because they're studying and things, and really they have 2 years to cram in all the information, and then they go on their clinicals, so they get very little time on most things, to be really honest.
Fantastic point. The field itself is not self-aware about the importance of sleep, and so it's really hard to take care of others. It's heal thyself first, right? That's exactly right. Great.
One more comment, and I've had sleep apnea for my whole life, and I go to a primary care physician, and one day I said, I've known you for 14 years. I even wrote a book about sleep apnea, and you've never asked me anything about my sleep apnea. And he was really embarrassed, but it occurred to me one day, I have heart disease, I have this and that, the other thing, but no sleep apnea. I wanted to make a comment. It was actually sent to me via text. Our chief medical officer, our science officer is watching this, and he just wanted to make the point to this gentleman that asked a question about, how do you know if you're getting good sleep? And part of the problem is that we don't have a good reimbursement system for follow-on sleep tests. We think, oh, well, maybe we should get a consumer device. But, the problem with consumer devices are they are not that accurate, right? So the really accurate thing would be a follow-on sleep test. And maybe you get prescribed, maybe you get a sleep test afterwards, probably not, because your machine tells you stuff. But your machine is only telling you that you're breathing. It's not telling you that you had a bunch of sleep fragmentation, oftentimes from the CPAP machine and the mask. So the best thing to do is to advocate for sleep tests and follow on. And to me, it's always crazy that, I might have gotten my prescription for my CPAP machine 4 years ago, and no one's saying, hey, did you get your test this year? Because it's expensive, right? They don't do that, but things change. I might gain 100 pounds, or I might start taking different kinds of medications. So I think just in general, I'm saying we need to advocate for less friction in the system to be able to find out how well we are. Thanks.
Thank you. And thank you so much again to this amazing panel. It's been an honor.
Thank you all.